Good morning, everyone. I'm Christy Stark, Director of Communications and Intergovernmental Relations for the City of San Marcos. And I want to thank each of you for coming out on this Sunday morning to join us for this. And I also want to say thank you to all of our Hays County residents who are watching remotely on our Facebook Live feed and are joining us here this morning. I'd like to recognize our elected officials who are joining us. First of all, we really appreciate State Representative Aaron Zwiener for coming this morning. We also have several mayors with us and also Hays County elected officials. We have Hays County Judge Ruben Becerra. We have Mayor Jane Hewson, Mayor Travis Mitchell, Buda Mayor George Hahn, and Wimberley Mayor Pro Tem Rebecca Minnick. From Hays County elected officials, we have Commissioners Lon Schell, Mark Jones, and Debbie Inglesby. And we also have our County Clerk, Elaine Cardenas. For the City of San Marcos, we have several council members with us here today. We have Dr. Ed Mahakanen, as well as Saul Gonzalez, and we thank all of them for taking the time to join us. We're going to have several people from in our cities, our counties, our emergency management operations speak to us today. And then at the end, we'll take about 5 minutes of questions from the press. We're going to detail the reasons behind the declaration of disaster and why that was important for the county and the city to do that at this time. Hays County epidemiologist Eric Schneider is going to talk to us a little bit about our first presumptive positive case for a Hays County resident, and also just to continually, for all of our residents and all of us together to remain calm and to also take those simple measures, those simple hygiene measures that help us to thwart the spread of this virus. We'll have our emergency management team will also speak about the efforts that have gone on for weeks among our regional partners as we've been in preparation for this. And then we'll also have the city manager for San Marcos. We'll kind of talk about the efforts that are being made within the city and how those may affect the core services that we provide to our community. Following that, we will have questions. So at this time, I will turn it over to Judge Ruben Becerra.
Thank you, everyone, for taking the time out of your Sunday to be here. In addition to all the people you heard that are here, we also have, as I see, our Buda city manager, and we can keep going. My hope is to share with you the unity that is taking place here. We are working together on every front. What you see is merely the tip of the spear of your government working for you. So the biggest message will be to understand why we're doing this. And so in my attempts, I will share with you that although the risk of severe illness may be low, we want every resident in Hays County to take the personal responsibility to prevent the spread. How do you prevent the spread of coronavirus, you ask? It is the easiest thing on the planet. It is very important that you follow these CDC guidelines. We have made many attempts, and we continue to see positive results from everyone taking every bit of caution and effort to follow these guidelines. Keep in mind, we didn't have an earthquake. We didn't have a hurricane. We still have lights. We still have water, and the supply chain will still move cargo. Let's just be honest. Everything's going to be fine in reference to supplies, and I might hate myself if I don't say it, but just to lighten it, just a little bit, I think we all have enough toilet paper. So I am leading a plan that is locally executed, state coordinated, and federally supported. I am grateful to have the visible show of support. I was on the phone at 2 in the morning with Senator Zaffirini, for example, also talking to Congressman Doggett. We are at every level united, and I am so grateful to be leading that charge at our local level. And for that reason, and because of the great job we've been doing as a community, staying ahead of what's going on, this declaration is not, if nothing, it's confusing, but that's why we're doing this. It's to stay ahead of what we're doing. We've been doing a wonderful job, as you'll hear what's going on, and this is to stay ahead of things and also to solidify and open up other channels of resources to keep us ahead. We're doing the best thing we can by doing this. I will not bore you all with all of the read of this declaration, but I will read the bottom part. Be it proclaimed by the County Judge of Hays, well, it's just dark enough in here. Just know that today I have signed, and our county clerk has also signed, the local disaster declaration. And you will hear before you're done today how this helps us as a community and why this is important, and most importantly, a wonderful tool to keep us ahead of what's going on. So without further ado, I will now pass it over to Mayor Jane Hewson.
Thank you, Judge. Since our State Representative Erin Zwiener is here, I'd like to ask her to say a few words, and then I will follow her.
Thank you, and thank you all for spending your Sunday morning helping to keep the people of Texas informed about this issue. I'll be very brief and just say that my office, the offices of Senator Zaffarini and Senator Campbell are all paying close attention to this issue and working with the state government to make sure that resources reach our local communities and that our local elected officials have all of the support that they need. I'm really grateful for the work of our school districts, our cities, and our county and our emergency service districts. And I really want to encourage the people of Texas to really follow all the advice of your local government officials, because that is how we will keep our community safe. With that, I'll hand it back over to Mayor Hewson.
Thank you. I want to thank Judge Becerra for this collaborative event. We know that local, regional, and state partnerships are critical during times like these. We have built very strong relationships with our partners at the local, county, and state levels, and we have relied on those relationships since learning of the COVID-19 outbreak. The city has been working for weeks on this collaborative effort, and I thank my council colleagues and our staff for their tireless efforts working on this and making it such a priority. Today, San Marcos, we are declaring a state of disaster, which activates our emergency plan and will allow us to allocate resources to utilize all disaster funding and resources available through state and federal agencies, and that's very important to each of us as a resident of San Marcos. We knew we would eventually see cases in our area. There's no reason to panic. It's time for everyone to remain calm and to continue to practice preventive measures. We're prepared to take the actions necessary to keep our community safe. The City Council and the city's leadership team continue to evaluate operating procedures at all city facilities and will adjust event schedules to proactively take precautions to protect residents and our community. We're in this together, and we'll get past this together with our coordinated effort. Our next speaker is the Mayor of the City of Kyle, Travis Mitchell.
Thank you, Mayor Hewson. Everybody doing okay this morning? I want to take just a second to recognize Councilmember Villalobos, Councilmember Scheel, and Councilmember Tobias for coming this morning. City of Kyle has been through quite the ringer, as has, I think, the majority of the planet. It's been very encouraging, really over the last several days in particular, to, as has been said before me, to witness the great efforts in collaboration that our elected officials, our staff members, our emergency service personnel, our emergency management team have undergone. We are in good hands here in the city of Kyle and in Hays County. Our school district is working around the clock in Kyle with Hays CISD, and we're very much prepared for whatever scenarios are coming forward. I'm very thankful this morning to hear from our chief of police that while there are lines at HEB, our grocery stores are being able to keep up with the strange purchasing habits that have been caused as a result of coronavirus. And I just want to encourage our residents and the residents of Hays County to please remain calm. to please stay positive, to be clean, and to stay informed. The City of Kyle has a website, cityofkyle.com/coronavirus, or COVID, I should say, cityofkyle.com/COVID. Hays CISD has put together wonderful resources. I know San Marcos CISD has as well, and Hays County and our emergency management coordinating personnel are working around the clock to ensure the safety of our residents. I do want to remind the public to consider two, or I should really say three groups of people. Number one are the elderly among us. As you have and are coming into or are aware of those that are elderly and sick, please keep them in your thoughts and prayers, and also try to find ways creatively and safely to assist them and encourage them to exercise safe hygiene habits and social distancing. Number two are the vulnerable among us, in particular those who are being affected, who may be food insecure or are having a hard time with where they might find residence. Please keep those groups in your thoughts and prayers, and look for opportunities to insert yourself into their lives through blessing and love, and making sure that they are cared for in every way possible. And then third, our local business community. This is perhaps as much as anything an economic challenge. Coronavirus is not playing fair. They are causing a lot of harm to our local business community, and the actions that we are taking today obviously have significant consequences to our local business community as well as the economy abroad. But here in Hays County, San Marcos, Kyle, Buda, Wimberley, please, if you are a resident, consider ways to creatively bless and support those who are suffering economically. Thank you very much, and I'm going to introduce Mayor George Hahn of Buda next.
Good morning, everybody, and thanks for coming. Echoing here. The City of Buda on Friday, after the declaration of disaster by Governor Greg Abbott, with consultation amongst all of the professionals in the room, declared a disaster for Buda. And again, as has been pointed out, it's not a declaration of emergency, oh my God, we got to run around and our hair is on fire. It is a means of gaining access to state and federal assets that are released with the declaration by the president and by the governor. So with the consultation amongst all of the senior staff of the city, I signed the declaration on Friday. But the thing is that the response that we are seeing among all the people is encouraging. We all understand that this is a rapidly spreading virus. We also understand that this is a virus that has not in the past been in the human population, and that's why it's spreading so quickly. We don't have a normal immune system to kick back to it. We have to understand also that the most vulnerable are the aged and our people that already have a compromised immune system or other health impairments. With all of that being said, we have to understand also that we have plans, protocols, and procedures that are in place. They're here. As you can see, we have all of the mayors in the region, we have Hays County, we have the state to provide support as needed, we have federal funds that are opening up as needed, the local businesses that are being impacted, especially the small businesses. The SBA, the SBA loans are low interest loans that are going to be issued to these small businesses. The Small Business Administration is going to provide funding to help offset the losses that are occurring during COVID-19 outbreak. Obviously, we are all in this together. Obviously, we have to look and see, how do we prevent the spread? What can we do as individuals to help? But the biggest thing is to not panic, to understand this is not necessarily a huge emergency. We did not see this kind of response when H1N1 hit the country. And H1N1 was killing thousands. We didn't see this emergency response and the panic that's occurring. The supply chains are open. Everything is going to be restocked. Everything is available. And the county, Buda, and all the cities in the county, the state and federal government, we are moving forward with the plans and procedures that were already in place. We've got this. There's no need to worry. Will you get sick? Maybe. Will you be able to buy stuff at H-E-B or Walmart or wherever you like to shop? Yes. So there's no need to stockpile your supplies. With that, I would like to pass it off to Mayor Pro Tem of Wimberley, Ms. Minnick. Ms. Minnick?
Well, I think I represent the smallest town in this area. I'd like to recognize Christine Byrne, our city council member, who is also accompanying me today. I wanted everybody to know that we're committed to maintaining strong communication with the county. As such a small town, we don't have a hospital. We don't have a lot of the medical resources that the larger communities have, so it's more important than ever for us to cooperate with each other. Also, we are profoundly affected by tourism, and even though we're seeing things slow down, in Wimberley, we still have a large number of tourists that are in our town, and we expect them to be here for probably the next several weeks during spring break. So that may make us more vulnerable. The other thing that makes us a little more vulnerable is that we have a much older demographic. We're a retirement community and a tourism community. So we have young people coming in that may be exposing our older residents. So with that said, we're going to continue to communicate. We're going to continue to model safe behaviors to our residents and to the community at large, and really appreciate the mayor of San Marcos and the judge for including us in this. Thank you. And I'd like to introduce Eric Schneider, who is the Hays County epidemiologist.
Good morning. As I said, my name is Eric Schneider. I'm the epidemiologist for the Hays County Local Health Department. I am here to just kind of help calm everybody down a little bit. This is a virus. It is just a virus. This is not Ebola that is going around. It is something that mimics the flu. It spreads around the exact same way. And so what we are recommending is making sure that everybody has healthy behaviors. They are washing their hands regularly. If you are sick, we just ask that you please stay home. Do not go to work. Do not go to school. If you're running a fever, you risk infecting other people, please. A lot of people in Hays County will probably end up getting this disease, but the majority of people that get this disease can stay home, just like you would normally with the flu or a cold. Wait till you don't have any symptoms, let it run its course, stay hydrated, and go back to your life after you're 48 hours fever-free. That's the point we want to make sure that everybody knows. 48 hours after you are done with this illness, you can go back to your normal daily life. Please do not go out in the public when you are running a fever. A lot of the medical professionals are sending calls my way. Your regular doctors can now run the tests to be able to test for COVID-19. And so what we ask is if you are showing symptoms of a fever, shortness of breath, cough, obviously we want you to seek medical attention. But there is no magic cure for COVID-19. There's not a pill that they can give you. And so you can test positive, great, then you're going to go home and get over it. That is what the majority of people are going to do. The elderly, people that are compromised immune systems, and the extremely young, those are the ones that need to seek medical attention. If you have the shortness of breath, we definitely want you to go visit a hospital because you will need to get oxygen therapy, anything like that to get actual treatment. But like I said, the majority of people let it run its course, and then you will go back to your daily life. As for the case here in Hays County, I was contacted on Thursday, March 12th, about a patient. The patient had recent travel to the West Coast, to multiple cities along the West Coast. Upon arriving back to Hays County, they were in the county for just a couple of hours. They were already symptomatic and running a fever, reached out to me, checked all the boxes, so we made sure that we got them into a local hospital to get tested. The hospital had all the proper procedures in place. They met them outside. They snuck them in through a side door, did not get them in contact with anybody else that was in the lobby. The patient was tested, was admitted, and the patient has actually already been discharged and is back home. Still has a few symptoms, but is in stable condition and is recovering at home. Like I said, the majority of people will recover at home. But that is what we're here today. I've heard the word disaster quite a few times, and I just want to reiterate that at no point did this person come into contact with any other Hays County residents, so the threat to the public is extremely low, if not non-existent at all. And at this point, I guess I will hand it over here to Rachel Engel with the City of San Marcos.
Thank you, Eric. I'm Rachel Engel. I'm the Emergency Management Coordinator for the City of San Marcos. As the Judge and Mayor have discussed, initiating a disaster declaration activates our comprehensive emergency management plan, as well as enables us to utilize all state and federal funding and resources that are available. Keep in mind that this is the reason for the declaration. We wanted to be able to utilize any state funding that had been made available after Governor Abbott made the state declaration. It's important to note that all of the local agencies have been participating in daily conference calls with the Texas Department of State Health Services in order to stay apprised of the latest developments with COVID-19. We have all been collaborating on a daily basis with San Marcos CISD, with our partners there, and making sure that all of our students are going to be safe and that we're ensuring safe practices and things of that nature. And we've been communicating with all of the other jurisdictions throughout the region to make sure that we're all kind of moving the needle at the same pace. San Marcos will continue to follow the guidelines set forth by the Texas Department of State Health Services, the Hays County Health Department, and the Centers for Disease Control and Prevention. We will continue to provide regular updates to our community as we learn of new information and any modifications that we make to our local planning efforts. This is a time for collaboration and teamwork, and that is with us, with the government, to make sure that we're keeping you safe, as well as on your part as a community. Remember that there's no need to stockpile all of your supplies. Our supply chain is safe. The capacity of our retailers is adequate, as long as our community members continue to maintain your normal buying patterns. For the most up-to-date information about city services and events, please monitor the City of San Marcos website at www.sanmarcostx.gov and the city's Facebook page, as these are your best sources of current information for San Marcos. A small reminder, as you're taking care of your family's needs, reach out to our elderly friends and neighbors who may need a helping hand during these next few weeks. Working together and helping our neighbors is what makes Texas, Hays County, and San Marcos such a great place to live. Next, we have Alex Villalobos, Emergency Management Coordinator for Hays County.
Thanks for everyone to be here again. I'd just like to come up here and echo one of our partners with the City of San Marcos, Rachel Engel, and all of the other emergency management coordinators throughout the county who are represented here today. I'd also like to recognize that we also have a lot of the school district representation here, San Marcos ISD, Hays Consolidated ISD, and I believe there's some Wimberley ISD here too. The reason why we recognize those things is to understand that we have been working for weeks for this day. The actions today have been planned several weeks prior to today, and we'll continue to do that, and we'll continue to run steadfast in front of all the actions that we're taking to ensure that what we're doing is in the best interest of the county. My job is here to help coordinate those aspects, talk to all the different agencies throughout the county, state, and federal agencies, and continue to be a student of this particular incident so that I can inform all of my other partners and so that we can stay out ahead of this as best as we can. Again, thank you all for being here. Your faces here show that we are in a well-developed and coordinated effort for the county, and we are here in the best interest of the citizens of the county, and we are staying out ahead of this to ensure that you have the resources that you need to operate on a daily basis and the guidance that you need to address any issues that you're having. One of the websites that we're using for Hays County is haysinformed.com. Other of the Hays County websites are also facilitating information. I know the county judge's office is also putting out information as well to direct you to various different informational sites so that you can gain information and learn more about what's happening today and future steps that we're taking later. Thank you very much for being here again, and thank you for your time, and thank you for all your efforts. I'd like to introduce the city manager for San Marcos.
Good morning, everyone. Bert Lombreras, city manager. I want to thank Alex and the county judge and certainly all our neighboring cities for being here. You know, today is an important day for a couple of reasons. One is not only to show the unification, but to show that and demonstrate that there has been a lot of coordinated efforts up to this point. We have had countless meetings, we have had countless number of hours and tireless effort by staffs from both the cities, from all the cities and the county. You know, just this Saturday we had almost a 2-hour discussion with all of our directors in terms of, you know, how we continue to prepare and how do we stay ahead as much as possible, and then what do we focus in on that are the more critical elements. At the local level, all local agencies are communicating on a very regular basis. We are ensuring that each entity continues to do their very best to provide the vital services that we have for the public under these set of circumstances. It's important to note that this is unprecedented in many respects. Certainly it's a strain of the flu, but I can honestly say there's not a set plan in terms of how do you handle every aspect of the provision of services that we have for the public, how do you handle gatherings, and so it's also a bit of a learning curve for a lot of us. We aren't, on the city of San Marcos, we are not planning to cancel all city events. We're going to be very thoughtful, very preventative in terms of the measures. I will tell you that this week we had, for example, 5 boards and commission meetings. We postponed them. You know, if there wasn't anything essential associated with it and it was going to create a gathering of people, we went ahead and postponed them. We're also looking at every event, every service within the city of San Marcos to see what we need to do. Up to this point, I can assure the public, anything that has an outward public-facing aspect to it, whether it's our city clerk's office that's issuing birth certificates and vital records, our utility billing, every area where we have customers coming in and out, the public coming in and out, we're going through very well established protocols in terms of disinfecting and cleaning the areas on a very regular basis, and then our employees themselves throughout the whole day. We've been undertaking these steps already for a while, and we will continue to do that throughout this event. So it's been very thoughtful. You know, we are evaluating the urgency and the need for these events, and it's safe to say that the way we do our business, the way we do our events is going to change, and even to the extent of how we provide valuable core services in San Marcos. You know, in terms of many of our operations, we're going to continue to be open. We are also being impacted just because of all of the school closures and the daycares. Our own employees are being affected by that. When you have 800 employees and you have to have people on the job, you know, to provide the critical services, we've got kids at home. We've got daycare challenges. So we're going through everything where we're looking at telework options. We're looking at how we can do alternate shift schedules, all of the different things that may create an opportunity for us to not only continue to provide the services, but then also, in effect, try to keep the employees available to meet their family needs. We have already canceled all non-essential travel. We're asking employees to report personal travel to make sure that we vet out the locations that they travel to. As I mentioned, the telework, alternative shifts, and then also evaluating all child care in school situations. Since many event cancellations and closures are affecting many of our local businesses, as has already been said, I know the Chamber of Commerce has already emailed information about resources that are available. It's also going to be available on our website. As our emergency management coordinator, Rachel, mentioned, we asked the citizens to watch the city web page, the website, and the Facebook page for the most current information, because things are evolving and things are changing pretty much on a daily basis. We're encouraging our residents to take advantage of any way of using online services to pay bills, to have as less interaction that we can. We're even going to the extent of evaluating how, if we're going to have one of our facilities open, how we can implement new social distancing procedures. And we're going to be rolling that out here fairly soon. So we encourage everyone to take advantage of those ways to keep up to date. As has been said already, and I can't emphasize this anymore, I know I've had the pleasure of working in cities now, 7 different communities, almost 40 years. This is a different, no doubt about it. It is different. But it is also a time for us to continue to work collaboratively, to work, as a region, as a county, as a group of cities, all working in the same way, because we all have very dedicated staff. They're working very hard. They're working on plans. They're working on measures of how do we keep the public safe. But at the same time, we need to keep our employees safe, because obviously we need to be mindful of the hard work that they put in. So this is unprecedented, but what is not unprecedented is for us to continue to work together and to stay calm, because we are going to get through this just like we've gotten through many of the other events that we've had to deal with, and I'm confident about that. I know that San Marcos residents are going to all pull together. So with that, thank you very much for being here, and I'll turn it over to Christy so she can wrap it up, and then we'll take some questions.
All right, so before anything else falls off the wall, we're going to try to wrap this up. I'm going to ask Eric, Rachel, and Alex if they will come, and we're going to allow about 5 minutes of questions. When we get close to that point, I'll let everyone know, but I'll just step out of the way and let them answer any questions the media may have regarding our preparations.
Have you discussed banning crowds of more than 250 people, like other cities are doing now?
That's part of our planning process right now for the City of San Marcos and Hays County. We're looking at evaluating those things in the future. At this time, we are not doing any of those types of actions.
The patient, for their flight home, can you tell us where they landed, and if it was a commercial flight, if others on that flight have been notified?
I'm working with the CDC. I've provided all the flight information to the State Health Department and to the CDC about all the flights that the patient was on and his exact seat location. And they are coordinating efforts to notify anybody else that was potentially on those planes as well.
And you aren't releasing publicly what airport in the area it was?
Correct. We're not mentioning that.
Can you mention where he lives in the county, or where or they live in the county, or which hospital they were taken to?
I cannot.
How old are you?
I'm sorry?
Their age?
The patient is 44 years old.
So the other person did not test positive, or did?
There have been multiple people that have been tested here in Hays County, but we have only had this one, and it is just a presumptive positive at the moment. We are still awaiting results from the CDC to find out if it was confirmed.
What would you say to people who are wondering if they should be going out, visiting restaurants, bars, that sort of thing? Are you encouraging people to still go out and do that, or are you encouraging people to stay home?
We're encouraging people to just live your normal life. Like I said, the majority of people that do get this disease are going to be able to stay home and let it ride its course, and you'll get over it and you'll be healthy. We don't want to discourage people from living their normal lives or affecting any of the businesses that are here in Hays County.
You know the exact.
I would say that some of the changes to that perspective would be that the new normal is wash your hands, social distancing techniques such as, elbow bumps, fist bumps. This is what we're doing on a regular basis in our community, and I think that's something that is a good leadway into how we should be communicating in the areas that we're congregating, whether it's restaurants and other social areas. I think we should be taking the lead on that as our citizens continue to go to those locations, is to use those best practices, washing hands, utilizing sanitizer when we best need to. I think that that's something that we are very hyper vigilant of, but we would also promote it. And we want to be good stewards and good examples of doing it and fist bumping all the time, okay?
You know the exact number of cases tested for the virus?
People that have been tested? I don't know the exact number. Excuse me. I don't know the exact number. This past week, the commercial labs were finally able to start testing. All testing has been done through the state labs, but now commercial labs can do it, so that's why regular providers can actually order this test now. I do want to tell people also, if you do not have any symptoms, if you don't have a fever, if you don't have a cough, getting tested does absolutely nothing. You will come back negative. Typically, you cannot test positive for this test until you've had a fever for about 48 hours. So the random questions that I do get all the time of people saying, should I go get tested because I think I was exposed? The answer is no. Monitor yourself at home. If you start to develop symptoms, you can contact your local provider, your healthcare provider. We don't want to overwhelm the labs. We don't want to overwhelm healthcare providers, and especially we don't want to overwhelm hospitals. Hospitals have to go around their daily routine where they have people who come in who are actually having a medical emergency. So we don't need people showing up saying, I want to get tested for COVID-19 just because they think they were exposed. You need to develop symptoms, and like I said, the majority are going to be a mild fever and a cough. You'll be able to stay home, you'll be able to get over it. If you start to develop the shortness of breath or have a fever that spikes, we definitely want you to seek medical attention, but the majority of people can stay home and just let it ride its course.
What's considered a fever spike?
They typically with this, they're saying 100.4 is about where the fever is of spike. Now, if you see a fever that's obviously higher than that, definitely we want you to seek medical care. But like I said, there is no magic cure, there is no pill for this, so they're going to provide you with pain reliever or Tylenol, Advil, something along those lines to help reduce your fever, and then send you home. And that's what most medical providers will be doing.
Has anyone from Texas State reached out for any recommendations or advice on how to deal with this or proceed going forward?
I've been in contact with Texas State, with their Student Health Center, and with quite a few other officials as well.
Can you give me any context as to what those conversations were like?
But I'd like to say also is that we have a representative from the university here, Dr. Caranco, who can talk about those particular initiatives that we got going on. Would you like to come forward, Doctor?
One of the initiatives that we've done countywide is to bring in all of our stakeholders within the community, the university, all the school districts, first responders, city government officials, bring everybody together in a large work group to talk about what all we're doing and what those preventative measures are and what our response plans are, so that we're all moving the needle together. We're all going forward at the same pace.
And this will be our last speaker.
So relative to what Texas State University is doing, first of all, I want to assure all Hays County residents that Texas State University is a full partner with San Marcos and Hays County in the COVID-19 response. At Texas State University, we've implemented a variety of measures to try to reduce the risk to our campus community and to members of the San Marcos community. So for example, we've implemented a policy where anyone that's traveled to a country with a CDC level 2 or 3 travel warning must self-quarantine for 14 days before they can return to the university. And that includes any area where there's active transmission of COVID-19. We've restricted all international travel. We've restricted all non-essential domestic travel. We've implemented increased infection control measures. We are implementing social distancing measures. We are also transitioning from face-to-face classes to instruction that's delivered online or through distance education. We've canceled all sporting events and intramurals. We've canceled all large events and programs. We've been working with the campus community to try to make sure that they're educated about prevention and the symptoms of COVID-19, how to self-isolate, and how to seek medical care in a safe manner. We continue to assess the situation on a daily basis, and will continue to modify our response measures as circumstances warrant.
All right, thank you all so much for coming today. I do want to give a shout out to Dripping Springs Mayor Pro Tem, I think Bill Folds, who might be joining us today also. So thank you all very much and enjoy your Sunday.